Hello, everybody, and welcome to our parent speaker series. This evening, we're going to talk to Adrianne Delgado from Bodymetrix in Limerick about eating disorders. Before I introduce Adrianne, I want to go over a few housekeeping pieces. There should be, probably down at the bottom of your screen, if you're on the phone, it might be in a corner somewhere, a Q&A feature where you can just pop in a question, any question you have throughout the presentation. I'll keep track of everything. And then at the end, Adrian does have time for questions. I'll read through them first, punt them over to Adrian. If there's anything really personal or specific to you or your child, we would definitely recommend reaching out to Adrian directly, keeping your questions a little bit more vague about the presentation, and all of her contact information will be available as well, should you want to be able to reach out to her. So I will introduce Adrianne. If you don't know her already, Adrianne received her bachelor's degree in nutrition from Westchester University, graduating with honors and a minor in psychology. She has nearly 20 years experience of outpatient nutrition care and helping with clients achieve results. In 2019, Adrianne wrote a family-friendly cookbook, Nourish, Eat, Repeat. And in addition to her videos on RCTV, you can listen to her weekly on her podcast, Nourish, Eat, Repeat. Adrianne's passions include helping her patients have positive relationships with food, improving energy levels, and living our best lives. So welcome, Adrianne, to Parent Center. Actually, that's not what this is called. That's what we did last night. Tonight is called Speaker Series. If you're interested, we also did a podcast or a show last night called Parent Center about the early intervention process. So we're just talking about everything here at Springford. But welcome, Adrianne. And you are on mute. It's Zoom, so we have to say it's okay.
It's also the end of the day. So thank you. Thank you for reminding me. Thank you for that nice introduction. I'm so excited to be here and excited to share this information and bring awareness about a much needed topic. So
absolutely.
All right. So I'm going to share my screen and we are going to get started. All right. So like Erin said, tonight we are going to talk all about eating disorders, what you need to know, and just a little bit about me and who you're listening to tonight. Like she said, my name's Adrianne Delgado. I am a registered dietitian and I am the co-owner of Bodymetrix Health and Wellness Services. We are an outpatient nutrition practice. So we see clients for medical nutrition therapy, which basically is a fancy word for if you have high cholesterol or diabetes or food intolerances. We will see you and help you formulate a plan that will help you feel your best. We also see clients for weight management. So that means for people that want weight loss or weight gain. We have sports nutritionists on staff. We actually have 11 dietitians that each have their own specialty and that really can come and meet you where you're at and help you reach your goals. I will make a quick note that most people don't realize that their health insurance does cover visits with a dietitian. So if that's something you're ever interested in pursuing, we'd love to help you navigate your way through that, verifying benefits. And so all you have to do is visit our website and learn more about us. And actually, this is an old website. I need to update this. Our website now is bodymetrixhealth.com. So that is my fault. So anyway, we are located in Limerick, right next to what previously was the Limerick Diner. And we are excited to mention we are opening another location right next to the Springford High School. So we will be a couple doors down to the right of the high school, if you're looking at it, right on Lewis Road. And so our Royersford branch will be opening December 1st. All right, so let's go into what we're going to be talking about tonight. So we're going to go over defining what eating disorders are, the different types of eating disorders. There are many. We're going to focus on 5 of them tonight. We're going to talk about the warning signs. What do you need to be looking for if you suspect an eating disorder? We'll talk about the causes, or what I like to specifically talk about are the triggers that can lead to one having an eating disorder. And then we'll talk about eating disorders versus overeating, or what appears to be harmless dieting, or emotional eating, things that we may partake in. How do we know if it's going too far and that we need intervention? We'll talk about treatment. We'll talk about the challenges, right? With an eating disorder, it's tricky. And so we'll go through what are the potential challenges that you might come up against, but as well as how we can rectify that. And then finally, we'll just put a note about recovery. So we do have a lot to talk about tonight. Like Erin said, if you have questions, feel free to put them in the chat and we'll answer them all at the end. But let's start by just simply, so we're all on the same page, let's define eating disorders. It is a psychological condition where people have an unhealthy preoccupation with eating habits, food, and body image. In the United States alone, 20 million women and 10 million men struggle with some form of eating disorder at some point in their life. That is a large number, and we honestly believe that that is much less than what is actually there, because a lot of people struggle with this condition in isolation or in silence. And so that is the record we have, but we project that number to be a lot higher. Those numbers are high, which means you may have struggled with an eating disorder at some point in your life, or you most likely know somebody who has struggled at some point. And so that's why we're doing this talk tonight, is to bring awareness on a topic that we can learn more about. And so if we see a loved one, a family, a friend member struggling, we know how to best point them in a healthy direction. Unfortunately, eating disorders have the highest mortality rate than any other mental illness. So again, we need to learn more about this so we can help those that are struggling. Now, there are a couple myths when it comes to eating disorders. Number one is, some will say, well, you can just look at a person and you can tell if they have an eating disorder. And that's actually not true. Eating disorders are more about the relationship with food and less about the actual food. It's more about how we think, how we feel, and how we relate to food. And those are things you cannot see, right? Because it's all a mental disorder. And so you can't just look at somebody and say that they have an eating disorder. It doesn't work that way. Not everybody is underweight that struggles with an eating disorder. Not everybody looks the part, but they could be struggling internally. Another myth about eating disorders is that it only affects Caucasian adolescent females. And that's not true either. Eating disorders can affect all people at any stage of life. Specifically, those vulnerable are the LGBTQ community, the Jewish communities, athletes. Men are also, we're finding more and more men struggling with eating disorders, and children, even children below the teenage years. And so again, this is something we want to learn more about so we can help those that are struggling. But it's not just your adolescent white females that struggle, it's across the board. All right, so let's talk about the different types of eating disorders. And really, I'm using the criteria from the DSM-5. That is a psychological book for diagnosing psychological disorders, the Diagnostic Statistical Manual of Mental Disorders. So that is what we're going to use for qualifiers. I want to just go through each of these eating disorders, talk a little bit more about it. Some of these you may not be familiar with, talk to you about the side effects and the characteristics. So we'll start with anorexia nervosa, which most people know as just anorexia. And this is a persistent fear of weight gain. Okay. There's also a restricted food intake. So people that are struggling with anorexia aren't allowing themselves to eat because the fear is that they will gain weight if they do. And there's also a distorted body image. So, it doesn't matter what people say to them, or I should say, it doesn't matter what people say, like, oh, you look great, you look fine, you don't need to lose any more weight. They don't see that. They have what we call a distorted body image. There is a pursuit of thinness at all cost. Okay, so no matter what, it's never enough, and it can get to be at a very dangerous level. It's actually the third most common chronic illness among adolescents is restricted eating. All right. Characteristic, we used to think that anorexia had to be a low weight. That was one of the things that categorized it. But now we know that anyone who is restricting can be diagnosed with anorexia. All right. Typically, though, we do see very low body weights because they're restricting their food intake so much. Side effects of anorexia is thinning of the bones, brittle hair, brittle nails, infertility, and a growth of a very fine hair all over their limbs and their body. And so these are some of the signs and symptoms you might see as a result of somebody struggling with anorexia. Another type of eating disorder is bulimia. And bulimia is a recurrent of binge eating. So eating large volumes of food over a 2-hour period of time. The thing with bulimia is it can either be an actual binge eating episode or a perceived episode of binge eating. So the person may not even eat a large quantity, but in their mind, they have overeaten. And so then there is some form of compensatory behavior. And when I say compensatory behavior, that means either purging, laxatives, enemas, or excessive exercise. There's a lot of guilt and shame and fear of weight gain. So then there is a compensatory behavior to offset it. And most people that fall into the bulimia category, they're not necessarily underweight. They may be, but most of them can be normal weight. So again, you can't always look at weight as a determinant of whether somebody has an eating disorder. Their evaluation of their body, much like anorexia, is very negative. And to be diagnosed is typically 1 episode a week for 3 months, or an average of 3 months. The side effects of bulimia include inflamed sore throat, swollen salivary glands, tooth decay, acid reflux, dehydration, and in severe cases, electrolyte imbalance. All right, which obviously puts you at cardiac risk and in very severe cases, death. Binge eating. This is actually probably the most common and the highest diagnosed eating disorder there is. Binge eating is very similar to bulimia in that there is an excessive quantity of food consumed, but unlike bulimia, there is no compensatory behavior. So there is no purging or excessive exercise. People that struggle with binge eating could be overweight or obese, depending on the quantity of calories they're consuming. There is an underlying fear of lack of control. There is shame, disgust, guilt associated with eating those large quantities. And the side effects of binge eating are increased risk for cardiovascular disease, stroke, and type 2 diabetes. ARFID is a generally new diagnosis in terms of its name. So ARFID stands for Avoidant Restrictive Food Intake Disorder. And this was actually previously known as a feeding disorder of infancy and young children. You had to be under the age of 7 to be diagnosed with this. But really what ARFID is the patient is struggling with eating a variety of foods. They really limit their food intake to about 5 to 10 foods. Some of that can be texture issues, taste and flavor issues. Sometimes there's a fear of gagging or purging, getting sick, vomiting if they eat foods. And so what ends up happening is they restrict their intake and they're at high risk for growth issues, for nutrient deficiencies. And most people, there's a difference. Let's back up here. So when kids are little, a lot of times they don't have a varied palate. We would call these kids picky eaters. ARFID is picky eaters that don't grow out of it. they continue to be extremely restrictive. And again, it puts them at risk for macronutrient deficiencies and for growth in growth issues. Symptoms of ARFID can be weight loss, poor development, and sometimes people that struggle with ARFID need to be on supplements or even tube feeds to supplement their lack of nutrients in their diet. All right. A lot of times ARFID is connected to OCD. So that's another interesting fact. The other issue with ARFID is it's very difficult for these patients to go out in social situations because they don't like a lot of foods. And so it's really hard for them to go to parties or holiday events because they just don't like those foods and they refuse to eat them. And then finally, the last eating disorder I want to mention is orthorexia. Orthorexia is the preoccupation with eating only healthy foods. Or sometimes you'll hear the words like eating clean foods. I only want to eat clean foods because I want to be the healthiest version of myself. What happens is, and eating healthy foods is great. That's something we all should strive for. But when it becomes a preoccupation to the point where you're not going over to other people's houses because you're unsure of the quality of the ingredients that they're purchasing, or you won't go out to eat because you don't know if the ingredients they're using are clean enough. And I'll put clean in parentheses here because defining clean is subjective. But what happens is, with orthorexia, there ends up being some restricted eating, but the motive behind it is different than in anorexia. In anorexia, there's this intense fear of weight gain. In orthorexia, which also will most times show weight loss, the motive isn't because they're afraid of gaining weight. Their motive is because they want to eat as so clean and so healthy as possible that they end up restricting a lot of foods in the process. All right. And then they're at risk too for nutrient deficiencies and for growth. So those are the 5 eating disorders I wanted to highlight. These are probably the ones we see most often. There are others, but these are probably the most common. All right. It is helpful to know that you can have more than one eating disorder. All right. Usually they will overlap or they can morph into different types over the course of that patient's lifetime. They may start with anorexia and then move into binge eating. And so they can also overlap with different mental health concerns like depression, OCD, anxiety, seasonal affect disorder. And so a lot of times you'll see these moving in and out in conjunction with other mental health struggles. It is helpful to diagnose the client because then we can identify the symptoms and we can address them in the proper way. And we can help them with treatment options. When we don't put a label to it and we make it more generic, we can't help them as well as if we had a diagnosis. So I want to move into what are the warning signs. All right, because what are the things that we can look for? It is important to remember that, again, with an eating disorder, food is a symptom. All right, it's how the disorder is expressed, but it really doesn't have anything to do with food. Eating disorders are more about coping with a stress or a sense of control. That is what eating disorders are at its foundation. It's just expressed with food. Okay. So what are the things that we can look for if we suspect somebody is struggling? What are the things that we can visually see? Again, we can't get into their brains because they're struggling with the preoccupation of food in their body. We can't see that necessarily, but what can we physically see so that we know somebody may need help? So first and foremost, dieting is the number one warning sign that can lead to an eating disorder. Interestingly enough, 80% of 13-year-olds have attempted to lose weight. 80% at 13. That's such a sad number, right? Because 13-year-olds should be, living their best life, going outside, playing with their friends, and to know that they're struggling means that we need to be having these conversations early and often. And because it's happening in kids younger and younger. We've seen them in as early as age 10. Okay, so if you notice that somebody is dieting, that's usually a trigger that can lead to an eating disorder. Somebody who has this preoccupation with intense dieting. For somebody that just wants to lose a little bit of weight, they kind of make some healthy choices or they make some changes and then they get off their diet. Then they might try something 6 months later. That is not what we're talking about. That's not an eating disorder. It's the intense focus and preoccupation to the point where it's messing up their normal daily life. They're not able to perform different functions because they're so fixated on it. Some of the things that you can see, though, from a warning sign, besides dramatic weight loss, that is one of the warning signs that you could see in an individual. If they're wearing baggy clothes, a lot of times they will try to hide the fact that they're losing weight because they don't want anybody to see and anybody to comment and anybody to know what they're doing. Again, with eating disorders, there's a lot of shame and guilt and isolation. Eating disorders thrive in isolation. And so there's a lot of hiding going on. So if you notice there's secretive eating, if you notice there's, for some individuals, they're hiding wrappers or they're hiding bowls under their bed, or they're eating in the bathroom. If you're finding a whole bunch of, packages or something that could indicate that somebody's overeating in a secretive way. If the person's afraid to eat with other people, they're afraid to be in social events where they have to go to a restaurant. If they have to eat in the presence of other people, they're very fearful of that. That's also a warning sign that something's going on. Sometimes a warning sign can be if the person decides to be a vegetarian or a vegan, and that's connected to their weight loss efforts. Sometimes that can be a red flag. It's not a red flag all the time. Again, these are just some warning signs that I want you to be aware of. So it can cause you to dig deeper and see if there's something worth intervening. Excessive exercise is another warning sign. They're constantly working out, or as soon as they eat something, they work out immediately afterwards to get rid of the calories. That is a warning sign. Being inflexible about food and or exercise. They're not able to pivot or change plans. Everything's very rigid and everything has to be done at a certain time in a certain way. That's also a sign. And just a common sign of all of these eating disorders is just ruminating about food. It's a constant thinking about it. It's a preoccupation with it. It's just all they're doing is thinking about it 24/7. What is the next meal going to look like? How are they going to get rid of it? How are they going to restrict? If you notice that they're jumpy, they're edgy, they are, in a really bad mood because they haven't eaten in a while. Usually grumpiness is a sign and symptom as well. Very hard to tell, though, when you're dealing with adolescents and teenagers, because sometimes they're grumpy just because they're teenagers. And then finally, another common warning sign is just this discomfort or a dislike or a shame about their body. They're not happy with it. They're constantly tugging at their body or looking at it or trying to suck things in or push things out. If you notice that they're in the mirror and they just constantly have this negative self-view of their body, that could also be a warning sign that intervention needs to take place. So those are some of the warning signs. Again, it's hard because at that point in time, things have already developed because this is more of a preoccupation. So by the time you see some of these warning signs, things have already started developing. So just want to be on our guard, and we want to make sure that we're noticing things as early as possible. In terms of the causes, I'd like to say that this is, this cause, this one thing causes an eating disorder, but really it's complex, it's multifaceted, it's not usually just one instance or one occurrence. So we don't like to call them causes, we like to call them triggers. what triggers an eating disorder? Well, there's a lot of different things that could trigger. First and foremost, genetics. All right. There could be a psychological predisposition. We know that in twin studies, if one twin has an eating disorder, the other is over 50% more likely to also struggle with an eating disorder. So there is a genetic component, a biological component. A low self-esteem can also contribute and be a trigger for an eating disorder. OCD tendencies or perfectionism. Again, a lot of times the eating disorder is not about food, it's about a stress or it's about something they can't control. And so, because they can't control an outside event, they control what they can with food and their body. And so, a lot of times you'll see those individuals that have that type A perfectionist personality want, if they can't control something that feels out of control to them. And so then they look to see how can they control their food or bodies. Another trigger can be if the person has friends who are dieting or obsessed about their bodies or thinking about food all the time, or like I said, have a negative view of their body. I think with social media, these kids, if you want to talk more about adolescence, but we don't have to stop there. We can stay with adults as well. We're looking at pictures of these bodies that don't even exist. We have to remember that a lot of things posted on social media have been adulterated and manipulated so that it's a version of a body that they think people want to see. But then when you have these impressionable minds that aren't mature enough to know what's happening, it can cause a really poor body image. If they see other people dieting, like older siblings or parents dieting, that can be a trigger. Certain communities where a body image is idolized can be a concern. Some sports like gymnastics, dance, even some cheerleading can cause more poor body image or just a higher concern for body. And so dieting, all those things can take place. So just something to be aware of. It's not to say that those activities are not good. It just means we have to make sure we're taking care of those people and constantly checking in with them. Interestingly enough, eating disorders are virtually non-existent in countries where they haven't been exposed to Western ideals of fitness. Right. So, in the United States, we have this really unhealthy preoccupation with a certain body image. So it makes sense that these young impressionable minds would also take on this preoccupation in an unhealthy way. So we have to be really careful. Again, we have to make sure we're having lots of conversations. Trauma can be another trigger if the client felt like their personal boundaries were violated. And then stress. Stress can be another cause or another trigger, I should say. And we have had lots of stress, especially over the past going on almost 2 years now. And again, remember, eating disorders thrive in isolation. And so when that person is removed from their social context, their family, their friends, nobody's checking in on them, nobody's like questioning them, that's where things can get dangerous. All right. It's really when things start to impede the quality of life where we need to be concerned. So when we talk about eating disorders versus overeating or emotional eating, dieting, because a lot of us have done overeating before. A lot of us have dieted before. Does that mean we have an eating disorder? Not necessarily. All right. The line between overeating and binge eating disorder, there is one that happens every once in a while, and then there's one that happens all the time. So every person has overeaten at some point in their life. It happens every once in a while. For some people, it does happen more often than others, but it happens, we may not feel great about it, but then we can go back into a normal pattern. The issue is when the overeating, or like in the example of binge eating disorder, is the only behavior in response to stress. When that person feels out of control, they tell themselves to stop and they can't. It's their sole coping strategy anytime they feel an uncomfortable emotion. That's when we need to get involved. If it's the occasional overeat, that is okay. We have all done it. It's when the overeating is always the compensatory behavior for stress. All right. If you notice the person is hiding food, or their bank account is always drained because they're buying large quantities of food to eat, that's impeding quality of life. That's when we need to intervene. The occasional overeat, no, that's just being human. Emotional eating, again, we all do this from time to time. I always tell my clients, we're emotional people. We're humans with emotions. And so there are going to be times when we, look to food for comfort. The problem is when we only look to food for comfort all the time. Now we've stepped over the line into that unhealthy preoccupation. And then in terms of dieting, I told you dieting is the number one trigger for eating disorders. So the occasional want to eat healthy, maybe focuses on more fruits and vegetables and lean proteins and a balanced diet. I don't have any problems with that. It's when it turns into something a little bit more severe, where it's a preoccupation, it's very rigid, there's no flexibility, then we know it's time to intervene. So let's talk a little bit about treatment options. And really, this is different depending on what type of eating disorder you're struggling with and the severity of it. The most important thing that you can do when you are trying to create treatment for a person struggling is you really want to create a team. And that team needs to be at least 3 people involved: a physician, a psychologist, and a dietitian. Okay, that's how you want to create a team, because there are a lot of different moving parts, and we want to make sure that we're addressing all the needs. So we need a medical doctor because we need somebody to be ordering blood work, who can manage electrolyte imbalances and is really looking at the physical health of the client struggling. All right. A lot of times there can be low heart rate. There can be, with the underweight, if they're malnourished, we need somebody overseeing care and making sure that that all facets are in place. We need a psychologist because, again, this is a psychological disorder. We need somebody to help with cognitive behavior therapy and helping provide tips and strategies for coping with uncomfortable emotions or dealing with trauma and helping that client work through it in a healthier way. And then we need a dietitian because, if the person is severely underweight, we need to come up with a plan to help them gain weight in a healthy way. If the client is severely malnourished, you can't just dump a lot of food into their system. That's called refeeding syndrome, and it doesn't end well. The body ends up rejecting it. So you need somebody who knows how to slowly increase the calories in a way that's healthy to the individual, coming up with options so that, if they're dealing with foods they don't like or textures they don't like, somebody who's well-versed in food and nutrition that can give them other options to try. And it's really important, if you are creating a team, that team collaborates with each other. You want all 3 of these moving parts to be working together, because sometimes when you're dealing with an eating disorder patient, they will try to pin you against each other, and they will say things that didn't actually happen to try to convince one of the other practitioners to give in or to not pursue a treatment option. So you really want to make sure that you're giving consent, that all 3 can talk to each other at all times, because you want those practitioners giving a consistent message so that no matter who the client is dealing with, they're getting that consistent message every time they go for help. And then that way the 3 can collaborate and make sure that they're moving forward as appropriate. There are a few different levels of treatment. And again, this ranges from, the least, I'll say, severe to more severe. So the individual outpatient is where you would do a one-on-one consult with a practitioner. That's done in an outpatient facility. The next level would be group therapy, where the patient is actually in with a group of people where they can support each other. We go into intensive outpatient next, where it's just the frequency increases. Instead of maybe once a week, they're meeting 3 times a week. They may be practicing eating in front of each other and really working through some of their struggles and concerns. They can practice all of that when they're in those intensive outpatient facilities. And then the most severe treatment plan would be an inpatient facility where they are there and they're living there overnight and they're getting help at all times. And so again, it really depends on what the person is struggling with and also how severe the eating disorder has gotten. All right, what are some of the challenges that we face? So probably the biggest challenges that we'll face, especially with something like an anorexia or a bulimia, is there is resistance from the patient. All right, so what does that mean? You know, a lot of times, if the client has been getting praise from other people, like their friends or their family members are telling them, wow, you look amazing, you look great, whatever you're doing, keep doing it. Right? We say these words and we mean it in good nature to let somebody know that you acknowledge their hard work, but you never know how they got there and if they have been involved with some of these unhealthy behaviors. We would never want to praise somebody, for an eating disorder, right? It feels harmless, but again, if these people are getting all this positive feedback and they have a low self-esteem and a distorted body image, and people are acknowledging what they're doing, they're not going to want to stop. Why would I stop this? I'm finally where I want to be. I'm finally getting the attention that I was looking for, that I needed to help deal with this stress. And so a lot of times, if you approach somebody, you're going to hit resistance. All right. They want to feel better. It's nice when there's affirmation. It's nice when they're posting pictures on social media and people are liking them and people are telling them how amazing they are. So to say, I'm worried and concerned about you, they're going to probably be met with a little bit of resistance. Another challenge is diet culture. Everything about, our country is this pursuit of thinness at all costs, no matter how you do it. In my practice, I see people all the time, who are doing some very dangerous things in order to achieve a specific weight or a look that they're going for. And every time they're doing some type of diet, they're really challenging their relationship with food and their bodies. And it puts them in a really in a tough spot. And so we have to do some healing work with that. But our diet culture encourages eating disorder behavior. And so to go against that is very countercultural. Lack of support network, or depending what their support network is. So a lot of times, again, if people are praising you for how you look and what you're achieving, they may see that as a good thing. They don't want to give that up. When it comes to the support, a person struggling with eating disorder wants help. At their core level, they want help. They want somebody to see them, see their struggle. Maintaining an eating disorder is exhausting. It's draining. I mean, if you think about a preoccupation with food 24/7, your brain never lets up. It's always thinking about it, always calculating the next move. That would be exhausting, right? And so deep down at their core, they want to give it up. They just don't know how. For those that have been struggling for a long time with an eating disorder, they have literally no way else of coping because they've used that one coping strategy for so long. And so, coming up with a support network, people that are going to ask the hard questions, who aren't afraid to go into that resistance, knowing that that's going to be ultimately what they need for healing. We need people to help. Again, eating disorders thrive in isolation. And so the more you can bring things out into the light and the truth and talk about it, however uncomfortable that is, it's important. The other thing that can be that we have to look at is, who are these client support network? You know, are these friends? Are there family members? Are they supporting these changes? And if the changes that they're making are harmful, are they calling them out? Or do they have a network that's actually going to be looking out for their best interest and is helpful? So we always want to look at, who are these people? Who are they spending time with? What are they looking at on social media? What is feeding their head day in and day out? What message are they getting? The other challenges with eating disorders is there are medical complications. Like we said, electrolyte imbalances, bradycardia. With some of the other psychological conditions, you're not necessarily having electrolyte imbalances, but because we're using food as our symptom, or how we're expressing our lack of control, there is a physical ramification for that. Again, it is the highest mortality rate of all psychological disorders. So it's important. We have to take it very seriously. And then again, the impact of isolation. So we do need to be careful of when we see a person withdrawing and not engaged in regular activities that they once were engaged with. We withdraw because we don't want people to know, we don't want people to see, we don't want people to question us. All right. And so when you are eating meals with other people, people notice if you're eating, they notice what you're eating. And so a lot of times when they withdraw from those social situations, because they don't want to be called out. And so we really need to make sure that isolation is the last thing we do with somebody who may be struggling. We want to make sure that we're checking in on them often. So I want to end with recovery, because, I don't want this all to be gloom and doom. I want you to be aware, but recovery is possible. It absolutely is possible. But I will tell you that early intervention is always better. Okay. We want to make sure that we're talking to people, like I said, early and often. This is a conversation you can have with children, and fostering a positive body image and what is healthy. What does that look like? Remember, especially when you have young kids at home, they're watching what you do, right? You can say all you want, but if you're constantly dieting and you're constantly looking for the next way to lose weight, kids see that. Okay. If they see you getting on the scale all the time, they see that, they notice that, they start to then question their own body, if it's good enough, or how can I look different? Watching what these kids are looking at on social media. Do you need to put parental controls on things? That's also something we need to talk about. For adults, sometimes we need to unfollow things that aren't healthy. If you're not feeling good about your body or yourself or your behaviors after you look at a certain person on Instagram, then you need to unfollow them, because ultimately it can lead you down a dangerous road. People that struggle with eating disorders, they can relapse, of course, after recovery. But the good news is once they've been through a treatment process, they do have more tips and tools in their tool belt, so that if they notice certain triggers are coming their way, they're able to stop them before it turns into something more intense. All right. The most important thing, though, is you find a team of people that you feel comfortable with, that you can be honest with and open with, because that's really where you're going to find the best treatment and find healing. In terms of getting the conversation started, again, don't be scared. I think that's why we don't have these conversations, because we don't want to upset the person. We don't want to make waves or jeopardize friendships or relationships. And really, when it comes to getting the conversation started, just even asking simple questions like, how are you feeling about your eating habits? And just, coming at it from a place of curiosity and compassion, never judgment. A lot of these people that are struggling with eating disorders, they're already judging themselves. And if they feel like that you are judging them as well, that feels very threatening, and they're going to put up walls and shut down. So if you are going to approach somebody, just do it with gentle compassion and curiosity, just to learn more. But that will give that person struggling so much in that moment. It may not feel like much, but when they feel like somebody notices them and cares about them, it's like one of the best steps toward healing. And so I would just encourage you, if you are concerned, start the conversation, because deep down inside, that person struggling wants to get better. They just don't know how to ask for help. And you could be an integral part in starting that process. All right. So I think that's all I have at the moment. I will send it on over to Erin, and she can see if we have any questions.
So this is the time now. If you have questions, use that Q&A feature at the bottom of the screen, or if you're on your cell phone, somewhere up left or right. I do have a few questions that came in ahead of time. My daughter confided in me that she believes her friend is anorexic. How is the best way she can support her friend without breaking trust?
Wow, that's a great question. And it really depends, I think, on, I don't know the age of these people, these kids, these youth. But I would definitely encourage her to talk to somebody that she feels comfortable with. So if that's not a parent, maybe that is a guidance counselor or a teacher or even the girl's mom. But again, we don't want to let this hide in isolation. We want to try to bring it to the light. So if there's a person that she feels that she can trust and start the conversation with, if not, and there's a deep concern that this is going into a place that's unhealthy, I would suggest that the girl talks to her own mom if she feels comfortable. And, obviously we want to help the individual struggling. That's the most important part. So the fact that she felt comfortable enough to maybe say something to her, or if she's close enough to let her in so that she recognizes there's a problem, we want to step in right away, because early intervention is the best shot at a quick and easier recovery.
Next question, would your service provide referrals for psychological care if an eating disorder is suspected?
Yeah, so we have a couple psychologists that we work with, that we that some of our dietitians that focus on eating disorders, that they work with them. So we don't have a set person that you have to work with, but we do have a couple names that we can refer out if you're looking for that component.
Do eating disorders trigger substance abuse or vice versa?
Perhaps. The thing that's really interesting with eating disorders is it's something you have to do. You have to eat to survive, right? So with substance abuse, some of those compensatory behaviors are not always necessary. Like, you don't need, obviously, alcohol or drugs to survive. And so you're looking for a coping strategy in the moment. The thing that makes eating disorders so tricky is you still need to eat. So it's a constant threat over and over and over again. So I don't know if there's a direct correlation. I would assume there would be some connection, but I don't know what the direct correlation is, if one can cause the other. It's just you're choosing a compensatory behavior.
And the last question I have right now, again, if you have a question, use that Q&A chat feature. At what age should we start having body positive and food positive conversations with kids?
Or as early as possible. I mean, you can even start those conversations at 2 and 3 when they're able to comprehend what you're saying. Obviously, you want to use age appropriate language, but I don't think you would want them to hear that consistent message all along, not just when they're going through puberty and like, oh, your body's changing. You may not like your body. Like, that's not the time to be saying things. You want to foster that really positive relationship all along. But again, remember, those kids are watching you. they're watching what you do, not just what you're saying. So it's important to start those conversations early, but also modeling to them what a healthy relationship looks like with your body and with food.
And it looks like that's all we have for questions right now. This is being recorded, so we'll publish this out through RCTV. And at the bottom of the screen, I'm going to get so tricky with including your information. So if people want to reach out to you, what's the best way to do that?
Yes, probably go to our website, which is bodymetrixhealth.com. You can schedule an appointment online, or you can just request to talk to somebody a little bit more about any of your concerns, and we'll match you up with the right fit. Like I said, we have 11 practitioners on staff, so it's really important to us that we find the best fit for you to give you the best care.
Great. Well, thank you so much for hopping on with us tonight, for going over this information. It's really important and really timely, especially right now, as you're talking a lot about the isolation and how that's affecting people as we're tiptoeing out of COVID, but going full throttle into fall and winter, and we're getting a little bit more isolated again. So that was interesting and something I don't think a lot of people realize.
Of course, my pleasure.
Great. Ooh, I have one question. I love when a late question comes in. Oh, is everyone else still hearing the call? It might be a tech-ish question. If you didn't hear the end of this, it is being recorded, so we'll make sure that I send that link out to everybody following this evening's webinar. But I don't think there's a question after this. So we will go ahead and let you sign off, and thank you again for joining us.
All right. Thanks again.